Kyphosis can very often be misunderstood because kyphosis is actually a normal position that could be in the spine. However, and when you have an abnormal kyphosis, it means that your kyphosis is too big, or you have a kyphosis where you're supposed to have a lordosis. A lordosis is typically where your spine actually bends towards the front of your body, and a kyphosis typically is where your spine bends towards the back of your body. If you have a kyphosis in where you need to have a lordosis, which is your neck or your low back, that would be an abnormal kyphosis where you're supposed to have a lordosis. If your kyphosis in your thoracic spine has gotten too big and you have too much rounding in the back, that is something called hyperkyphosis. So even though that kyphosis itself is a normal condition that occurs in the spine, we should have a normal kyphosis. If it becomes too big, it's called hyperkyphosis, and that's the most common word that's associated with kyphosis, somebody having too much kyphosis. Now, the good news is there is treatment options for kyphosis. If it becomes severe enough, unfortunately, surgical intervention could be a treatment option to try to manage and reduce the kyphosis. However, conservative treatment options like therapy, rehabilitation, chiropractic care, corrective bracing can also has a significant impact if it's done properly and coordinated properly in order to get the very best reduction. So like similar to scoliosis, kyphosis can be managed and reduced before it becomes surgical level, but early intervention and early treatment, those two things together normally indicates the best prognosis.